Good day, I'm Hendrick Angelo from BSN 2-8. Today, I'm going to discuss the drug literature of Losartan potassium. Here are some information about Losartan potassium. Losartan potassium was first approved for medical use in the United States by the U.S. Food and Drug Administration or FDA. Merck & Co. Inc. under the brand name Cusar received FDA approval for Losartan potassium tablets on April 9, 1995. This approval was for treatment of hypertension or high blood pressure. For the presentation outline, first is description, properties, indications, drug interaction, dosage and administration, and lastly, precaution. First is description. Losartan potassium is a medication primarily used to treat high blood pressure or hypertension and certain types of heart failure. Here are some properties of Losartan potassium, and these properties make it a valuable medication for managing high blood pressure and protecting against certain complications associated with cardiovascular and renal diseases. First is anti-hypertensive property. It achieves this by blocking the action of angiotensin II receptors, leading to vasodilation and a reduction in blood pressure. Anti-hypertensive property ay nakakatulong to sa pag-reduce ng risk of cardiovascular events tulad ng heart attacks, stroke, and heart failure in the patient with hypertension. Next is selective angiotensin II receptor blockade. It prevents the vasoconstrictive and aldosterone secreting effect of angiotensin II, resulting in vasodilation and decreased blood pressure. This selective action helps to minimize the side effects and improve tolerability compared to the other anti-hypertensive medications. Next is renal protective effect, particularly in patients with diabetic nephropathy or kidney disease due to diabetes. It can help to slow the progression of kidney damage by reducing intraglomerular pressure and proteinuria or excess protein in the urine, thereby preserving kidney function. It can help to preserve kidney function and reduce the risk of complications associated with kidney disease, improving the long-term outlook for patients with these conditions. Next, the indications. Losartan potassium is primarily prescribed for the treatment of hypertension or high blood pressure. But did you know that it can also be used in certain types of heart failure and diabetic kidney disease to improve outcomes and prevent complications? Overall, Losartan potassium is a versatile medication that plays a crucial role in managing various cardiovascular and renal conditions. Let's proceed to the drug interactions of Losartan potassium. Number 1 is potassium-aspiring diuretics. Concurrent use of potassium-aspiring diuretics or spironolactone amiloride with Losartan potassium may increase the risk of hyperkalemia or high potassium levels. Careful monitoring of potassium levels is necessary kapag gumagamit ng potassium-aspiring diuretics, especially sa mga patients na may kidney impairment or other risk factors for hyperkalemia. Number 2 is nonsteroidal anti-inflammatory drugs or NSAIDs. Like ibuprofen and naproxen may reduce the antihypertensive effect of Losartan potassium. Additionally, NSAIDs can impair kidney function, especially in the patients with pre-existing renal impairment. Number 3 is certain antidepressants. Monoamide oxidase inhibitors and tricyclic antidepressants may potentiate the hypertensive effects of Losartan potassium, increasing the risk of low blood pressure. It is important to inform your healthcare provider about all medications you are taking, including antidepressants. Before starting treatment with Losartan potassium, your doctor can help monitor for potential drug interaction and adjust your treatment plan accordingly to ensure your safety and optimize the effects or effectiveness of your medications. Next is the dosage and administration. Number 1 is hypertension. The usual starting dose of Losartan potassium for hypertension is 50 mg once daily. The dosage may increase to 100 mg once daily based on individual response of blood pressure control. Number 2 is heart failure. The recommended starting dose of Losartan potassium for heart failure is typically lower, often starting at 25 mg once daily. This dosage may be gradually increased to the target maintenance dose of 50 mg once daily depending on tolerability and response. Number 3 is diabetic nephropathy. For the management of diabetic nephropathy, the typical dosage of Losartan potassium is 50 mg once daily. In some cases, the dosage may be increased to 100 mg once daily based on renal function and proteinuria levels. Losartan potassium is typically taken orally in the forms of tablet, with or without food. It is essential to follow the dosage instruction provided by your healthcare provider and to take and medication regularly as prescribed. Do not adjust your dosage without consulting your doctor, as dosage adjustments should be made under medical supervision to ensure safe and effective treatment. If you miss a dose, take it as soon as you remember, but do not double the dose to catch up. If you have any questions or concerns about the dosage or administration of Losartan potassium, consult your healthcare provider for guidance. Losartan potassium, like any medication, comes with certain precautions that should be considered before starting treatment. Here are some important precautions to keep in mind. First is pregnancy. Losartan potassium should not be used during pregnancy, especially during the second and third trimesters due to the risk of fatal harm. Second is liver impairment. Losartan potassium should be used with caution in patients with impaired liver function. The medication is primarily metabolized by the liver, so dosage adjustment may be necessary in patients with hepatic impairment. Third is kidney impairment. Individuals with impaired kidney function should use Losartan potassium with caution. The medication is primarily eliminated through the kidneys, so dosage adjustments may be necessary in patients with renal impairment. Lastly is angioedema. Rarely, Losartan potassium can cause angioedema, a serious allergic reaction characterized by swelling of the face, lips, throat, or tongue. It is important to discuss any concerns or questions about the precautions associated with Losartan potassium with your healthcare provider before starting treatment. Your doctor can help assess your individual risk factors and determine if Losartan potassium is the right treatment option for you. Next is side effects. Dizziness, lightheadedness, headache, tiredness, and upper respiratory infections. More serious side effects can include kidney problems, high potassium levels, and allergic reactions. Storage condition. Losartan potassium tablets should be stored at room temperature, typically between 20 to 25 degrees Celsius. Generic availability. Losartan potassium is available as a generic medication, which can be more affordable than brand name versions. Remember that Losartan potassium is a widely used medication in the treatment of hypertension, heart failure, and renal protections. As an angiotensin II receptor blocker, it effectively lowers blood pressure, reduces the risk of cardiovascular events, and protects the kidney from damage. However, certain precautions should be considered, such as avoiding its use during pregnancy, monitoring for electrolyte imbalance, and using caution in patients with renal hepatic impairment. Overall, losartan potassium is a viable medication when used appropriately under the guidance of healthcare provider, contributing significantly to the management of various cardiovascular and renal conditions. I hope you learned about drug literature of losartan potassium. Thank you for listening.